expliquer...
Je vais donner une courte déclaration, si vous me permettez. Today we're going to be talking about healthcare again. We are in a really serious crisis across the country, particularly with children's hospitals, and our children are bearing the brunt right now of the healthcare crisis. So we need to see immediate action from the federal government, from the Prime Minister, to meet with the premiers, to find solutions to deal with this crisis. Donc on a une crise de santé pédiatrique. On va demander des questions pour avoir des actions concrètes pour faire face à cette crise. C'est clair que le Premier ministre manque de leadership et il doit rencontrer les premiers ministres des provinces, trouver des solutions pour régler cette crise.
Comment vous expliquez Mississauga Lakeshore? Votre vote a fondu là-bas alors que vous avez, par exemple, obtenu des soins dentaires pour les enfants.
C'était toujours un comté qui est fort libéral, donc ce n'est pas quelque chose de surprenant. Mais quand j'étais là, j'ai parlé avec les gens et plusieurs personnes ont partagé comment les soins dentaires sont importants, comment on a un problème d'abordabilité à ce moment au pays. Et ils ont aussi partagé comment ils ont peur pour l'avenir et l'importance d'avoir une réponse sur l'inflation qui ne met pas plus de pression sur les épaules des gens.
But isn't that a bit of a, like, I mean, everyone keeps saying it's a strong Liberal riding. So what? You're just supposed to walk away, not fight? This is democracy. Either you think the Liberals are doing a good job and you want to support them if you're a Liberal candidate, or you're a New Democrat saying, no, vote these guys out.
Well, we want to win the next election. I want to be the next Prime Minister of this country, and I want Canadians to know that I will fight for them in a way that they've seen with the things that we've delivered. Doubling the GST rebate, bringing in rental supports, bringing in dental care. And for a lot of Canadians, that's going to mean a big difference. One result in one by-election that for 3 decades has been Liberal is not really going to inform my decision around the future of our movement or our party. But the work that we're doing is certainly resonating with people.
Can I ask you about Liberal ethics? Morneau, Trudeau 1, Trudeau 2, LeBlanc, and now Minister Ng, all found guilty of violating the law, the Conflict of Interest Act. What do you think about that?
We expect that politicians should follow the law, and violating the law is wrong. I'm concerned particularly where the spending impacts the ability of Canadians to have the services that they need, when it's major decisions that impact our ability to get the care that Canadians need. And right now, my major focus is on things like affordability, the lack of action on dealing with inflation. So the only response has been the Bank of Canada increasing interest rates. That hurts people. That's something that I'm really upset about. I'm worried about the lack of action on healthcare, where there's no action on dealing with the major crisis, and where the Liberal government's failing there. That's what I'm focused on. But we expect politicians and everyone to follow the law. And when they don't, that's a problem.
The Bloc Québécois just basically said you're bluffing about pulling your support for the federal government over healthcare transfers. Have you become the boy who cried wolf on this, sir?
Well, what we said really clearly is that we are fighting to make sure this government delivers on healthcare. And the Prime Minister has been missing in action, and we're fighting to make sure the Prime Minister steps up and shows leadership. We reserve the right to withdraw our support. That is something that we reserve, and we are particularly worried right now that there is no action on something as serious as the healthcare crisis impacting children. So that's what we're focused on, and we want to get results. We want to see this Prime Minister do something. The Conservatives aren't raising this issue. The Bloc aren't really are missing in action on this, and the Prime Minister is missing in action. We're the only ones really fighting to make sure that there's action. We speak with healthcare workers. We brought a nurse to Parliament, and she shared her story about how difficult it is for those workers to not be able to do the job that they were trained to do because there's no resources, and that's what we're focused on.
Est-ce que pour vous, le prochain budget, ça passe ou ça casse? Dans le sens que s'il n'y a rien dans le prochain budget fédéral sur les transferts, est-ce que ça pourrait être un deal breaker, comme on dit?
Le prochain budget va être un test, pour sûr, un test de notre entente. Et on doit avoir des actions concrètes pour régler les problèmes. Un exemple, c'est la crise de santé. Donc, on veut et on doit avoir des actions et des engagements concrets pour régler cette crise. Oui.
Est-ce que vous l'avez soulevé avec M. Trudeau? Parce que vous avez des rencontres régulières avec M. Trudeau. C'était quand la dernière fois que vous l'avez rencontré? Et est-ce que vous lui avez déjà transmis ce message-là?
Hier, on a eu une rencontre avec le Premier ministre et j'ai partagé que le budget va être un test. Et en particulier, j'ai encore souligné l'importance de voir des actions pour régler la crise dans notre système de santé.
À propos de la police militaire et des cas d'agression sexuelle,
J'ai manqué la
à propos des cas d'agression sexuelle dans l'armée, est-ce que vous croyez que la ministre Annan a besoin encore de consultations avant de savoir s'il faut définitivement retirer les cas de la Cour martiale?
Ça suffit à ce moment. Ça suffit. On a des exemples systémiques pour longtemps qu'il y a un problème de violence contre les femmes dans les forces canadiennes. Et c'est inacceptable que ça continue. On n'a pas besoin des consultations, on a besoin des actions. Une demande qui était claire, c'est d'avoir un processus indépendant pour soulever des plaintes. C'était une demande depuis longtemps et ce gouvernement n'a pas agi. Qu'est-ce qu'une autre consultation va faire quand on sait déjà une étape fondamentale proposée par un ancien un ancien juge du Cour suprême qui a dit qu'on a besoin d'un processus indépendant. Donc faites le travail.
How does the government get a passing grade on the test that is the budget? Is it 28 billion, no strings attached, like the provinces want?
Well, the test is going to be to see some action on some key priorities. We want to see action on dealing with the healthcare crisis. That's going to be important. We understand and recognize that Canadians expect money that's designated for healthcare should go to healthcare. I think that's reasonable. And having checks and balances in place makes sense. So we support that, but we want to make sure that there's real commitments and concrete steps taken to deal with the healthcare crisis.
What does that mean? What does action mean? Like, unpack that a little. So
Sure.
is it money, or is it, we want to see wait times come down? What does action look like?
Yeah, a number of things. So first of all, ultimately, it's to deal with the crisis that we're up against. So what's the crisis? We got the Red Cross showing up to a children's hospital in Ottawa, trailer set up in a children's hospital in Alberta because the demand is so high, children dying in Montreal, healthcare workers saying they've never seen a situation this bad. So fixing that. What does that look like? Well, there's three major things that have been laid out by healthcare workers. One is we need to recruit and train more workers here in Canada. So that means having more spaces in universities and colleges to train more workers. There's many Canadians, thousands and thousands of Canadians that live in our country that have international training that aren't working in healthcare. We need to unlock that potential, and that's something very fundamental. Thirdly is making sure that healthcare workers are paid enough so that they are retained. This is something that's been long raised as a major issue. And we've got healthcare workers that are leaving the profession because they're not getting proper pay. Those are three steps that we want to see happen concretely. We know that the federal government can do a lot to address the shortage of healthcare workers with the immigration system, working with provinces. We want to see that.
Monsieur Singh, le Québec devrait-il envisager de recevoir 112 000 migrants par année, quasiment tous des francophones, de sorte à la fois résoudre l'enjeu du poids démographique et de la pénurie?
Je pense que c'est important de reconnaître la force d'immigration, le pouvoir d'immigration de régler les problèmes dans notre système de santé, avec la pénurie de main-d'œuvre. Donc, c'est important. Et
112 000?
le chiffre, ça doit être quelque chose qu'on analyse avec les besoins et analyse c'est quoi les besoins dans le marché, c'est quoi les besoins dans le système de santé et puis avoir un chiffre qui ressemble aux besoins. Merci.